supine on the tilt table before standing her up. The tilt table is a great choice for therapists because it allows the patient to be fully supported while giving the therapist the ability to use their hands. The patient is supported with straps at her hips, her knee, and her foot. The foot is held in adduction at midline, which translates to gait in mid-stance. Now that my patient is supported with a yoga block behind her back, it'll allow for full hip extension, and we've placed a rise underneath her foot to encourage weight shift to her left side. The rise is under her right foot. Because my patient is here and secure, I am now able to instruct her on reaching activities. I am holding her hand on her right side down to the table, which will encourage the patient to reach, fully activating her QL. This is the same setup using the tilt table, but rather than having my patient's right leg down, I've placed it on a chair. From here, I can have my patient perform hip flexion, encouraging her to have controlled hip flexion, and on her left side, her glute med and glute max are going to be firing like crazy. I can also have my patient encourage weight shift by having her reach from the pole here as well. This is also a great position to have your patient in to do single leg mini squats. So squeeze, 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 squeeze. Now the setup can resemble even a total gym doing a full mini squat. It's much like a total gym in the sense that the fact that the patient can come down, but she's completely supported, and with the use of the strap, her knees are now able to buckle. Once we're finished with that, I can move my patient onto core exercises with a weighted ball. I place my patient in prone before standing the tilt table up. In this position, I placed her left leg onto a chair, allowing for a hip flexor stretch. I've used a yoga block to keep her right knee from buckling, and she can now achieve terminal hip extension. This position is very advantageous for us to be able to have our patient do other things, such as activation of the rhomboids, while performing rows with TheraBand. So this patient is receiving the weight shift on her hemi side, activation of her rhomboids, and is getting a hip flexor stretch.